people come on in, we'll welcome those to come.
Sounds good. All right, well, good morning, everyone. Welcome to the OPA question and answer forum on group consultation for new telepsychology users. As we were talking about a little bit ago, we're all in this new boat together, working through telepsychology, and there's lots of changes, lots of confusion. So that's what today's forum is really going to be on, and helping each other navigate those waters. The efforts this morning are part of OPA's service to our membership. So on behalf of the OPA board and the OPA staff, I do want to thank you for attending and spending your Saturday morning with us. My name is Lexi Smith. I mentioned earlier, I'm currently the chair of the OPA Association of Graduate Students, so OPAGS, and I am the student representative on the OPA Board of Directors. So I'll be moderating our forum today. And I first want to get started by introducing our two speakers. So Dr. Kelly Martincin received her doctorate at Cleveland State University and completed her predoctoral internship at the Hampton VA Medical Center in Hampton, Virginia. She then completed her fellowship in the chronic pain management program at the Cleveland Clinic before becoming a staff psychologist at the Cleveland VA within their behavioral medicine service. Working in integrated medical settings, Dr. Martincin often uses telehealth to allow veterans with disabilities and other disadvantages greater access to care. And her primary areas of interest are chronic pain, neurocognitive disorders, and wellness within the geriatric population. And she currently serves as the chair of the Public Sector Interest Committee for OPA. So thank you, Dr. Martincin. And then Dr. Cindy Van Keuren received her doctorate in clinical psychology at Xavier University in 2003. She then completed her predoctoral internship at the Cleveland VA, also in 2003, before moving on to a 2-year residency in the chronic pain rehab program at the Cleveland Clinic. After 15 years at the Cleveland VA, Dr. Van Keuren is now a staff psychologist within the Cleveland Clinic Neurological Institute. Her primary interests are in chronic pain management, adapting and coping with disability, headache management, and program development. And she's currently serving as the president-elect for OPA. So thank you, Dr. Van Keuren. So again, just a few logistics before we get started in case anyone has, since we went over this, please mute your speakers if you're not speaking to avoid any noise that is not relevant to what we're talking about. And then again, please use the chat function at the bottom of your screen. If there are any questions that are being brought up in the chat that are not being seen, I'll make sure to relay those to Cindy and Kelly. And I'll be mindful of time and giving us time updates as we go on. So with that being said, I will turn it over to Cindy and to Kelly.
Thank you so much, Lexi. I appreciate it. I do just want to go ahead and make sure that you know there's some other forums similar to this coming up. Monday, the 27th at 6:30, there will be a geropsych telepractice, but that one is sold out. That is with Dr. Martincin. And there will be another geropsych telepractice on May the 13th at 7:00 p.m. That one has not yet been posted, so keep an eye out for that one. And the Prevention and Wellness Program has been offering weekly self-care as well. So there's an event coming up Tuesday, May the 5th at 7:45 p.m. So those are all free. You are welcome to all of them. Please consider those, except the one on Monday, it's sold out. So OPA has been trying very hard to meet the ever-evolving needs of our members as we quickly transitioned over to telehealth. Jim Broyles did an amazing job of covering insurance issues. A lot of those, Jim's forums can be found on the OPA pandemic resource page. So please be sure to check those out. Kelly and I have our telehealth experience from the VA, so we just don't know about insurance. We just don't. So we're not going to be helpful to you in that regard. but we have a lot of practical experience. And so we figured that now that people are in there doing it, you've probably run into some problems, you've encountered some strange experiences, and we want to help with those. Problem solve, troubleshoot, whatever we might be able to do. If we don't have an answer, we will get back to you. We will be happy to research that information and send an email in a couple of days. The areas we really hope to get to, how to do assessments, is telehealth appropriate, how to get consent, require documentation, how to determine appropriate procedures, especially for managing emergencies, how might you report or observe abuse of vulnerable adults or children, competencies, best practices, those sorts of things. But because it's consultation based, we want all the questions coming from you. Those are just the areas where we have the most knowledge versus things like insurance. So with that in mind, please unmute yourself anytime you want to ask questions. The mute is really just to do things like block out my dogs that are definitely going to bark in the next hour, or any other background noise, but really this is your time. So please unmute freely and ask your questions. And with that, I'll turn it over to questions, or to Kelly if she's got anything in particular you want to add to that.
No, I want to make sure that this is really focused on your specific concerns. As Cindy mentioned, this is consultation. You guys are already experts in your field. So how can we help you just navigate, you know, kind of the bumps that we all encountered as we were getting started in telehealth?
Okay, I have a question. The things that you said you were going to talk about are not what I need. I need specific help with how do I get a client onto Zoom? How do I set up the Zoom properly? I had some real difficulty this last week. I tried to change the password that they gave me, and my client was unable to use that password. It kept saying it wasn't correct, and she put it in too many times and got shut out. We tried to fix it in a number of ways and ended up just doing a FaceTime call, which was not as useful. So can you change the password that they give you? Maybe not.
Yes, I have a little bit of experience with this. And actually, one of the C2C blog posts this week is going to be on Zoom. I don't know that I'm going to cover passwords specifically in the blog post, but you can change the password. That's something that can be done, and that would be done from the page where you set up the meeting. So that initial setup is where the password is located. It's where you choose whether a password is required, and it's one of the safety features that Zoom has created kind of in the wake of the Zoom bombing and the things that we were hearing about a few, weeks to months ago. So that's the initial place where you would change the password. And so I would encourage you to think about maybe what you're doing with your passwords, you know, making it user-friendly for you and your clients. So what's an easy thing to do? Like maybe therapy 1, something like that, that is easy for you to remember as well as your client, and then how to keep track of all that. So if that's something that you would like to do.
I did do that. I changed it on the invitation, but she wasn't able to get in using the password I changed to. So I was stuck.
That might be just kind of one of the strange things that does happen then, that you know, but that is where that would be where the initial invitation page is where you set the password, where you set the need for the password, and you know, making sure that you guys are on the same page. So if you both had the same password, you clarified that, she's typing it in, making sure she's aware that it is case sensitive. She's not adding any extra spaces, dots, dashes, numbers. That would be the thing. If I were on the phone with a patient, are you sure you don't accidentally have your caps lock on, that you're putting in all capital letters or no capital letters, things like that. That's how I would troubleshoot with the patient.
Mhm.
And I'm also wondering too, if you change the password after the link was sent, and I don't know that you did this, Jane, I'm just kind of problem solving other things that may come up. But if you sent it, the invitation, and then change the password, I wonder if it needs to be a new invitation. What, have you run into that, Kelly?
I think it probably would be. I haven't tried to change it after the fact. It might need to be a
I
brand new
haven't either.
invitation. That's probably how I would do it. I'd have to look at it specifically. When I've personally changed the password, I've done it straight from that invitation screen. So either I leave it as what Zoom automatically sets it up as, which is random letters and numbers, and then just copy paste it, or I change it right from the beginning. I haven't tried to change it after the fact.
And when I've been using Zoom for non-HIPAA compliant issues, such as just a meeting or something, I've just been undoing the need for a password. So I suppose when all else fails, if you did that and then resent a link.
Mm-hmm.
And it looks like, Gary, you wanted to kind of offer some advice related to doxy.me.
Yeah, I didn't know if it came through. Just a comment, I'm very new to this, and I have found doxy.me to be really easy to work with. It's HIPAA compliant, confidential, and they give you a business agreement. It sounds less complicated than what is being talked about. So that might be something to check out, that's all.
Yeah, Doxy is nice. Doxy is one of the free HIPAA compliant platforms because it is one of the ones that comes with a BAA. It does have the end-to-end encryption. Zoom is, the free version of Zoom anyway, is technically not HIPAA compliant because it doesn't come with that BAA. To get the HIPAA compliant version of Zoom, it's actually quite expensive. So you have to buy a multi-license version, and I think it's almost $200 a month, but you get multiple licenses. So if you have a large group practice, that might be a good option for you. That being said, right now, while we're in the crisis, there is the waiver. So the free version of Zoom with the 40-minute sessions, you're good to go because, of course, we're all taking those reasonable precautions that the governor has mentioned, using the passwords, using the waiting room function, things like that on Zoom, all fall under the reasonable precautions. But Gary, you're right. Doxy is another really popular one. My co-chair of CTC, Dr. Quinn, she uses Doxy and really likes it. The one criticism she has of Doxy is it doesn't have the video quality of Zoom. Zoom has a much higher, you can see, we all have a pretty crisp video quality that we're having right now, we're enjoying. She says Doxy doesn't have the same video quality, but it's free, it's HIPAA compliant, so it's a good choice for a lot of people.
And I would agree with Gary. I've been using Doxy.me and it's very user-friendly. Some of my older patients really struggle with all of this telepsychology. And it's really been simple for them too.
Great.
The big thing for them is, you know, I've had 3 people who have had to upgrade their flip phone or something to a smartphone, which has been a learning curve. But the main thing for them is just reminding them to be sure that their microphone is enabled and their speaker enabled and their camera enabled. But once they get that, you know, I would say that to Joan, Doxy.me is so user-friendly and it's just the click of a link for the patients and they seem to like it. I agree with you, the quality of the video is nothing like this. This is better, but that sacrifice, nobody really wants to be seen on camera these days anyways.
That's true. That's a very good point. But I appreciate that reminder too, that for a lot of our folks who perhaps are not as comfortable with technology, you know, building in maybe a couple minutes at the beginning just to review those things. And help them to feel comfortable with the equipment so that they can focus on the reason for meeting with you.
I don't know how to use chat. I tried to type something, but then I don't know how to get it sent.
You should just be able to hit enter when you're done.
Enter on my computer. Okay. Thank you.
There you go. Perfect.
Thank you.
Oh, Jane's a planner. How long do you think we'll have the waiver? I've not heard. Michael, maybe. Have you heard anything about? Nope. You're ahead of the game, Jane. So that doesn't sound like there's talk about that yet. So for the foreseeable future, we've got a waiver.
There should be plenty of warning, I would think.
Yeah.
I have another question, a different area. Are you ready for another question?
Of course, please.
And I've heard this is a repetitive thing, and it has to do with the locale of the client or clients and the locale of the psychologist. And I know some things have been waived, okay? Can somebody give me an update on the latest take on that issue?
Are you referring to billing or to privacy? What are you referring to, Gary?
I'm referring to the ethical issue of what state, the therapist, the therapist or the psychologist in Ohio, and the client has to be in Ohio. But I understand there's some flexibility to that. And I have a colleague, I was talking to my wife earlier, interestingly, who lives in Kentucky, but practices in Ohio. And I've been doing telehealth stuff, telepsychology at home, and he hasn't. And she said, well, maybe that's why, So it has to do with that issue,
Across state lines. So I know that there was an email that went out recently. So more broadly, please support SciPact when all of this quiets down. That is something that's already been in the works to provide services across state lines. For example, if that were already in place and when the colleges closed down, people could continue to provide care to their college students who have now gone home, perhaps to other states. So long-term planning, when we put that back on the front burner, please be sure to support that. Temporarily, there have been some other measures. And Michael, I know an email just went out, but I will be honest in saying I did not read thoroughly about a temporary implementation across 50 states. Is there anything that you could say about that? And I'll try to find it.
That's something that APA is trying to get approved, but I don't think it's happened yet. That was from Jared Skillings. Actually, I didn't read it either, but I'll read it now.
Okay, so what OPA has been promoting, and this is information you can find on that pandemic resource, is if you're practicing somewhere like Pennsylvania or Kentucky, to do an application for a 30-day temporary license in that state. And I've been hearing good feedback that process has gotten pretty quick and easy. So that's another option as well if you've got a patient.
What that email said, it's a list of all the states and what waivers they've passed.
But Michael, that's not in place just yet, correct? That we still have to apply for those waivers. Say if we have patients in Kentucky or Pennsylvania, we still have to apply for that right now. Okay.
But it's a smooth process now.
Gary, does
Not
that
so much
answer
in the
question?
beginning.
Or did you have further questions about practicing across state lines right now?
No, I was asking the question about before all this started, what was the actual ruling on that, where the client had to be. I realize there's a lot of indefiniteness and things in motion, but obviously I'm a psychologist in Ohio, so I can only practice in Ohio.
Breaking up. Oh, there we go.
Yeah. So I was asking the question about before all this pandemic stuff happened, what was that, the understanding of where the patient had to be and where the psychologist had to be?
Before all this started, they have to be in the same state.
Right. That's what I thought. Okay, thanks.
It's where the client is that determines who has jurisdiction. So if you're in Ohio and the client's in Kentucky, then it's under the jurisdiction of Kentucky.
And part of that's for the protection of the patient. If they have a claim to make against you, or find some, that you're some malpractice, where would that be reported?
All right, thank you. That's what I thought. I just wanted to confirm that. Thank you.
Mm-hmm. Thank you. Good question.
Okay.
What other questions brought folks to today's forum?
There's a few people we haven't heard from yet. Who else has questions? I guess another way I could phrase this is, for people maybe who haven't spoken up yet, what brought you to the forum today?
Mm-hmm. Well, and hopefully everybody's learning practical skills just by being on the other side of the other chair, in terms of kind of navigating chat boxes and mute buttons, and again, appreciating what that might be like for our clients who are already presenting with some sort of emotional distress, and then trying to navigate this.
I have another question.
That's just, please, Gary.
Okay, if nobody else does. This is something that's in the future. When we go to renew, we have areas of competence, right? And I don't remember, was telepsychology on the previous one? And then whether it was or not, will it be on the new one? Is it competency area?
So it is a specialized area of competency that requires additional training and supervision. That is not something we've revisited as a board to see if that will change down the road, but it has been deemed that way. And to become competent, there are still things that you could certainly do now. There's some free webinars and some other resources available to you, that whether or not that ends up meeting the criteria, and certainly Michael, correct me, that's to be determined, but it should help you to feel more proficient and effective in providing that service.
My question was more technical than that. When we go, and you may or may not know this, when we go to renew, do you know if there will be maybe the answer is yes, if there will be an area of competence called telepsychology or something like that?
There already is.
There is.
It has been. Okay.
Mm-hmm. Yeah, there has been. And so now we just need to figure out whether people will be grandfathered in, or what that, will the criteria be any different? But yeah, it's been a specialty for several years.
And if we did not declare it, and now with this pandemic, we've taken a lot of courses, is it best to wait until the renewal then to declare it then?
So our new CTC chair, who's been in place for almost a week, we'll give her a little time to get settled in, and I'm sure that that's one of the things that will be addressed and figured out is, again, can we grandfather people in going forward? But for now, you've got the sanction of OPA. We encourage you to do these trainings. We're not looking to punish people for adapting to the current time. So you're okay.
Thank you.
I'm sure the state board isn't looking to punish people either.
No.
No reason. I mean, everybody's doing telepsychology now, whether they're competent or not. So,
Well,
just try to do the best you can.
Exactly. And that was the purpose of these consultation groups, whether you've been doing telepsych or not, we're all kind of forced to right now, and we're all here to meet the needs of our clients. So we're all trying to become competent if we weren't already. So if it is something that you feel like you would like to apply for in the future, once all this is passed, please, absolutely do it. And who knows, Gary, maybe in the future you can help us facilitate, you know, once you become a master at these things. So yeah, it would be something that, you know, I would encourage you to maybe apply for down the line. But right now, let's just focus on the needs of our clients and making sure that we're all providing the highest quality services that we can right now. So take it day by day.
And exactly how would we get supervision for this that would count along with our additional training?
See how those things happen? So things like this would count. This is consultation. We are speaking directly to issues that you've run into. And we're gonna, I think we'll probably do these forums less often after May, but still available. That's certainly an option.
Mm-hmm.
I'm always available to anyone that needs a resource like this. I'm happy to do it.
Okay.
And again, maybe in the fourth wave of CTC, that might be something they can look into. They've got some other catch up to do.
Yeah, absolutely. We're reformatting the committee right now. And I'm sure that people who are already certified, you know, we could perhaps get a panel together of people who would like to do that, because Gary, I'm sure you're not alone that saying, hey, now I have this new skill that I wasn't planning on getting, but lo and behold, you know, here we are. So you're not going to be the only one thinking in that direction. And so absolutely. So Elle Witt, I was wondering what brought you to the forum today? You must have seen it advertised and said, hey, that looks interesting. What about our forum looked interesting to you?
Well, I really don't know what questions to ask.
Okay.
So this is all a learning curve for me. I'm taking the training APA offered.
Great.
Really, I'm just really learning.
Okay. So I wonder if you're finding yourself in kind of that place of you don't know what you don't know.
Right. Mm-hmm.
Okay.
But I'm learning very consistently. These consultations are very, very helpful.
Okay.
So yeah.
All right. Has there been anything that you said, well, that's different, or that's strange, or that's a little hard for me, that we could maybe brainstorm together with you today?
Not particularly. You know, I have people I supervise, and thankfully the APA, they've taken that as well. They've taken that training. So we're all on the same page as far as the learning curve. But not really. We're pretty huddled together.
Okay.
You know, by phone, of course.
Yeah.
So yeah, we're just moving along and doing the best we can.
Okay, great.
Mm-hmm.
Well, I'm in the same boat. I had a brand new intern starting with me this week.
Mm-hmm.
She's brilliant and wonderful, and so that's kind of something else that I'm navigating. How do I train a wonderful and amazing intern in the midst of a global pandemic? So not only am I training her on safe use of telepsychology, but also how do I supervise over telepsychology? And so she is almost, well, 1 day a week she's physically with me, but 4 days a week she's at home, you know, and distanced. So how do we bridge that gap and make sure she's getting high quality training as well? So if you have any questions about that, we can brainstorm that together too. And I love that we even have Lexi with us. So maybe Lexi can talk about some of her experiences. You know, what a beautiful thing that we have. So
yeah,
if anything kind of crops up that you're thinking of, gee, can we brainstorm that together? Feel free to bring that here too. This is a pretty broad group that we have today. Okay.
Sure.
Awesome. Let's see. And our next question, I think, comes from Jane. There's been some talk of WebEx by Cisco as a platform. Has anyone used it? Is it a good one? That's not one that I've used specifically. Anyone else on here used Cisco? I couldn't speak to that one. And I really don't know how to define a good platform. I mean, by good, do you mean HIPAA compliant? By good, do you mean high quality? So some of the things that you're looking for, if you're looking specifically for a HIPAA compliant platform, You want to make sure that really the two big hallmarks are end-to-end encryption, making sure that both on your end and on the patient's end that it's encrypted, that nobody can hack in from either end. And also the BAA, that's the Business Associate Agreement. What a BAA does is it's basically a documentation of shared risk, that the program is accepting some of the risk in the very rare event that there would be any kind of a breach of privacy. So there's currently a waiver for HIPAA compliance right now, of course, because of the crisis. So we don't need to be sticking to those things, but some people are still looking for that. So if it depends on kind of what you're looking for by a good platform. Some people are looking for user-friendly, and in that case, what you want to do is probably just try it out. See if you find it to be user-friendly. And so there are honestly too many platforms on the market to have anyone be an expert in all of them. Does that answer your question?
And if I can respond to Jane's second question, so I just went ahead and tried to log into the free APA training, and she's not been able to sign up. Well, neither can I. So the screen that I just got, I followed the link from OPA's pandemic resource page to APA's free webinar on telepsychology. And it's saying that because they have such a high demand for the product, that product's just currently not available. It does give you the option to send one email, do not send multiple, just saying that you're interested in the program. But you are absolutely right, Jane. It's just, it sounds like it's been saturated and overwhelmed and it's not currently available. OPA does have a webinar. Please be sure to check that one out, but, and go ahead and email APA, and it sounds like maybe a waiting list is being generated.
Okay, and Jane, you clarified easy to use and easy for client to use. I have a feeling that's probably highly subjective. For instance, I think Zoom is really easy to use, but other people say, oh my gosh, Zoom is impossible to use. So I would encourage you, if Cisco is one of the ones that you're interested in, maybe take a look around and see if you can demo it for yourself. That's what I would encourage you to do. That's actually how I learned Zoom. I took an hour and just kind of played around with it. I actually, I called my mom and I said, hey mom, will you Zoom with me? And we played around together and we figured out how to download some of the fun backgrounds and things like that. So I can attend a meeting as if I'm at Hogwarts Castle, and things like that. Learn some of the fun features and whatnot. Cindy's laughing. But well,
I'm just thinking, let's make that into a projective game. What backgrounds we all choose.
I downloaded my favorite Australian beach. I mean, it's what's the mood? Am I in a literary mood or more of an Australian beach mood? But really, and I think it's just you have to spend the time to figure it out and just play around with it on your own. So.
And maybe use each other, other people coming to these consultation groups that are also new and trying to problem solve and troubleshoot, and just say, hey, I'm trying this platform, can I call you? And give each other feedback. So it's not as frustrating as it is when these, challenges come up with a patient. You can be challenged and sympathize with each other and provide empathy and stress management all at once.
Well, and truthfully, so VA, where I work, uses an entirely different platform that's not available to anybody else. We use VA Video Connect that is only available to VA. And when this platform was rolled out a few years ago, this is how we learned how to do it. We were practicing with each other. So I had a colleague that was a couple doors down, and he and I were practicing, literally just kind of calling each other back and forth to learn the features, make sure it was working smoothly. So it's just kind of dedicating the time until you feel comfortable with it. And, even learning some of the emergency features that are built into our platform. So every platform is going to be different. It's really learning the ins and outs of the platform that you decide is best for your practice. Okay, and I see we had a couple of other people come and join us. Welcome. Just for our newcomers, we're doing a couple of different things. We're primarily using the chat box. So if you'd like to go ahead and type any questions you have into the chat box, the chat feature is located in the bottom middle of your screen. If you click on that and then type a message into the chat box, we're answering those as they come up. Or you can unmute yourself and just join the conversation at any time.
And for our participant who's participating by phone, you won't be able to see the chat box, but we read those questions aloud so you'll know what's going on. But please just unmute yourself and join into the conversation.
Okay, who's next? And if you don't have a specific question, feel free to let us know what brought you to the forum today. You know, any specific topic that you're drawn to, like I'd like to know more about choosing the right patients for telehealth or building rapport in early sessions, things like that. Even if it's just a broad topic that you don't have a specific question on, we're happy to cover those things.
And Jane, it looks like April's offered someone that can be helpful to you in trying to get to that APA webinar, that training. Now, what about any issues? Oh, go ahead, Kelly.
I was just saying thank you to April. That's awesome. Thanks for providing that contact info. And yeah, and Jane, I hear you that, you know, you feel like you're getting exhausted and it's getting worn out, and it can be really a grind, you know, to feel like you're putting in a ton of energy. You know, so I'm glad you keep attending these sessions, that we can help support you, because it's a long road for a lot of us. You know, so I'm glad you're still here, and we're here to help in any way that we can.
And see, that's why we use the mute option. My puppies are very excited.
All right. And who else?
And just in review, go ahead.
Sorry,
I was just going to say, and in reviewing some of the things that Kelly and I were prepared to talk about, I'll just kind of go through some of those areas to see if there are questions that folks have run into. I know when I first made the transition to telehealth years ago, my biggest concern was about safety and how to manage a patient emergency or you know, anything along those lines. And I just wonder if people have some questions or have some anecdotes that they've run into that they feel they handled well, anything that you'd like to share.
Okay. S. Repley asked, how is everyone securing signed permission for telepsychology?
And so we do have a consent form on OPA's website that you are welcome to use. A lot of folks have been either, if you really like mail and you've got enough notice, you can mail it to them and have them mail it back. But you could just ask the patient to scan it in and email it back to you as another way to make things happen more quickly. So no point reinventing the wheel. We've got a informed consent form for you, ready to go.
How about other
Any
people?
follow-up? Any follow-up on the permission, the consent forms or consent issues that you've run into?
Yeah, I know a lot of people are just kind of including that in some other consent forms that they're already using and signing, that's just kind of part of the packet. Like I said, I work for VA, so we roll a little bit differently than private sector people. But it's my understanding that people in the private sector who have been doing telepsychology for a long time, they just put it in the packet in the beginning with all the other consents that people commonly do. So if people want to be setting themselves up for future practice, that might be something that you want to start doing, and consent, just in case we need this down the line, start getting that from day one.
Right, but the problem is I didn't have it from day one.
Mm-hmm. Yeah.
Right.
we were all kind of thrown into this, and I did talk to Glenn Carr, and so he put some things together for me. But my question is how I get that. And you're saying really do go ahead and mail these to patients and have them sign it and mail it back?
Yeah, you can start with a verbal consent and then tell them, I'm gonna put this in the mail. Just mail it right back to me. So you can start with a verbal consent now, document that you have the verbal consent.
Yeah, I do have that, and I've documented that, but I just haven't mailed out the paperwork.
Yeah, yeah. That's
and at the VA, even though we have the written consent and the consent to treat for the whole VA service, at the beginning of every single virtual session, we have to get verbal consent, and we just make a note of that in the documentation. So you're okay. And again, this is all crisis management for the world. So there's some flexibility there when, when you've clearly made an effort to get consent and follow the laws under these circumstances.
Yeah, so just start with verbal consent, document that you gain verbal consent and that the written one is either in the mail or being emailed to them, that they're going to scan and email it back. So that'll at least not slow down your process. Okay, let's see. And then other people are commenting, mailed or taken a picture and sent it back. Yeah, that's great. Mail worked for other people in Southeastern Ohio. Yeah, we've heard a lot about, connectivity in Southeastern Ohio. That's an area that has a lot of need in terms of telehealth. And we have a wonderful rural health committee that's kind of helping to triage some of the issues that we're facing, trying to get service to our friends in Southeastern Ohio. Yeah, so hopefully you're right. Hopefully Medicare is going to start covering phone sessions. All right, and let's see.
Well, if I can add one more thing there, poor Jim Broyles, who probably hasn't slept in 6 weeks, he is doing such a good job of keeping on top of that, advocating, collecting information. And as soon as he learns something new, he posts that on the listserv, and then it gets posted to the pandemic resource page. So folks are getting overwhelmed at times by the listserv or just feeling like, they're not sure what's relevant. You always have that very nicely organized pandemic resource page that Keuren must update every day. It's so current. So that's another way if you're getting kind of overwhelmed or lost in all the emails, please be sure to check out those more succinct summaries there.
Yep, and April commented that she works with a Medicare Medicaid agency. HIPAA laws are allowing them to use FaceTime or Google Duo. And she says document that you mailed it. You're absolutely right. We currently have a waiver that right now you don't need to necessarily use HIPAA compliant platforms, that you just need to take reasonable precautions. We talked about that at the beginning of session today. So yeah, just those reasonable precautions that we're doing everything we can. And so that's why you can, start with a verbal consent and document that it's in the mail. That's a reasonable precaution, given the pandemic. So.
And if I can go back to something that Gary mentioned earlier about the supervision and consultation, I'm saying this not just as a practitioner, not as a OPA member or board member. I would also just include in your documentation that you're participating in consultation groups, that you're attending the trainings, that you're in the process of getting that competency. It just makes me feel better. But again, there's no rule, there's no official perspective from OPA that that's something you should do, but something that just might help.
Yeah, it doesn't hurt to document. What other questions do people have, or other things that maybe drew them to this forum today?
I was wondering how people are handling the probability that we'll be wearing masks in the session, probably for a while.
Absolutely. Yeah, that was something that lit up our listserv this weekend. It was fun to see the really poignant discussion that everybody was having. And, you know, it was a reality that hit home. And, you know, actually it's something that came up with my intern on Friday, because our medical center announced on Friday that we will all need to be wearing masks pretty much everywhere as of Friday. That's been our directive. And of course, the CDC guidance is that we should all be doing that when we're out with other people anyway. So, you know, I think it's going to be something that we're all going to have to make the individual decision of how we're going to handle it. And so it was kind of fun to see how different people are talking about it, that different people are saying that it's going to be grist for the mill within a therapy session, that they're going to be using it as different process points. And so for me, because I work in a medical center, I have, I guess, the luxury of the thought process has been taken away from me. If it's a directive from my medical center, it's a decision I don't have to make. I will be wearing a mask. So that I've already done a little bit of that because part of my job is to respond to emergency situations. And so I've already been in the room with a COVID positive patient. So I've obviously been wearing a mask for my own safety and the safety of others in that situation. And so I guess what I've thought of in that moment is it's my job to be present with every patient and kind of overcoming that. And that is the mask really going to get in the way of my job to be present and to be there for every single patient, whether they have COVID or not. So that's how I've conceptualized it. And it's going to be really interesting having further conversations with my intern on Monday about how she's going to feel wearing a mask with patients. So it's going to be an interesting challenge, how we're going to be able to use, you know, other nonverbals beyond, you know, our mouth to communicate that we are still fully present with them. But I think for a lot of people, it's going to be an ongoing decision of what is best for you in your practice. We're all aware of the CDC guidelines. Are you going to follow them or not? So.
Well, I like to think of it as the safety of my client is first.
Yes.
And I'm seeing a number of people. There are some teletherapy, but probably 60% of my clients are still coming in.
Okay.
And so they come in with mask, and I accommodate that. And when people don't have a mask, my office is large enough that we sit far enough apart, and people, you know, I have a couple of people that I supervise, but they're seeing their clients via teletherapy. So I'm the only one that has people coming in. Well, I take that back. There are a couple of other, but the majority of mine are coming in. The majority of theirs is teletherapy. So I support the safety of the client, and I haven't had any complaints really. And plus, it's not a white mask. It doesn't look like a medical mask. I sew, so I make different ones and try to be fashionable about it, like match them to my clothes. So it's less of a threat. I found that to be less of a threat because, I mean, I have bad allergies, so I have a good supply of N95s that I have to use whenever I'm doing anything. But in the session, I think it's important to not look like I'm afraid of germs. This is a current situation that it could last a year, I don't know, but it's a current situation. It's not, I don't think it'll be a permanent. So I support it.
And let's not forget how adaptable our patients are too, because I work in an inpatient hospital. So for 3 or 4 weeks now, it's been a mandate that every provider, every human being in that hospital is wearing a mask. And so now that's become the norm.
Yep.
I think if I walked into a patient's room without a mask on, that would that makes them uncomfortable. Yeah, right. So patients can adapt to the times. The area where I continue to run into trouble is with my patients who are hard of hearing. Without this extra cue to help them, that's been very, very difficult. And I'm not sure I've come up with a solution yet that I love. And Jane is right. We can tell them, we can just kind of add those pieces in. I'm smiling right now, give them some extra cues. And I think we all know smiling eyes, right? I mean, that does, when you're genuinely happy, it does reach your eyes. And I think that that's become our new way of communicating a little bit.
Yeah.
But no harm in saying that. Okay, we've got 8 minutes left. We probably have time for one more burning question. Well, what about some feedback for Kelly and Lexi and I in terms of whether this kind of forum is helpful? Is this something we should continue to offer in the coming months? Just a quick chance to kind of problem solve around something you've encountered.
Yeah, I think it's extremely helpful, and I appreciate you doing it. And whatever amount of time is reasonable. There's just so many things floating through our heads as we deal with this transition. I was thinking that for me personally, I have been more stressful adapting to sort of the administrative, setting things up, dealing with consent and email and all that kind of stuff. The clinical stuff, particularly for clients I've worked with, is actually easier than that. But it's a whole new thing when you're starting off with new people. So what I've done, I probably should have done this earlier, is have like a flow chart, very specific. Okay, is it a new person, is it a returning person, and what do I do? And what forms do I send? What I do is I talk with them first and then email and send them, then they send back a consent form. So just talking about these things is just really helpful. We know that's how it is, right? Thank you.
Gary, I'm really interested in your checklist kind of algorithm. Is that something you'd feel comfortable sharing? I'm sure that would be helpful to a lot of folks as we're trying to figure this out.
It's so recent. I did this morning. I've been doing this. I don't have it downstairs, but
I'm sorry, Gary, you're breaking up a little bit. Are other folks able to hear Gary?
I've got some other people walking over the. Can you hear me now? Can you hear me now?
There's a lag.
I don't know what happened. Okay, all right. But anyway, I would encourage other people to do the same thing. And in each practice, it may be different.
Sure. But I like the idea of kind of points to consider. What am I forgetting to do? What am I not thinking of? Checking your environment, I think, is an important one, and one that I forget all the time. So I like the idea of a checklist. Maybe we can come up with something, like as a collective group here.
Well, I think this has been really helpful, and I just appreciate your doing it. Thank you for that. By the very nature of this pandemic, we're all isolated and alone and out here trying to figure it all out. So it's great to hear from other people and just kind of share experiences. So thank you for doing this.
Thanks for joining us.
Yeah, and thank you to all of you for your thoughtful questions. Otherwise, we'd have no content. This really is meant to be that kind of problem solving. Here's what I've experienced and here's what I don't know. And I'm glad that all of you were willing to kind of take that risk of sharing your experiences today.
Lexi or Michael, did either of you guys have any closing comments, any announcements, or anything that we should all know before we wrap up today?
I want to thank everybody for being here, and I'm glad that we're able to help this way, and we'll continue to do it.
Yeah, again, I echo that. Thank you for participating. And as Cindy mentioned, the upcoming forums and town halls in the future, please be on the lookout for those. And these will certainly continue to help meet everyone's needs.
Lexi's organizing one of these for grad students too. So.
Awesome. Thanks, Lexi.
Yes. Yes. So if you have any graduate students who are OPAGS members, or if they're not and they're interested in becoming a member and attending, yeah, we haven't extended this service yet to graduate students, and we as a board felt that it would be helpful to offer the same kind of space and opportunity. So that'll be next week, next Thursday.
Thanks for doing that.
Yeah.
That's gonna be great.
Thank you, everybody.
Thank you.
Thank you.
Bye.
Bye.